Good morning, everyone, and thank you once again for joining us for our Women with Heart Online series. We're very excited about today's presentation. It is all about blood pressure. And of course, our presenter today is Dr. Paul O, and he is our leader here, our medical director at UHN Toronto Rehab in the Cardiovascular Prevention and Rehabilitation Program. And I'm sure all of you have heard of Dr. O. So without further ado, I will pass it on to Dr. O.
Great. Thank you so much, Lisa. It's a pleasure to be with all of you today. I wish it could be under different sort of circumstances, but we've all come to appreciate that connecting even virtually has been very powerful. It's a nice way that we actually can stay connected in a different way. This session, by demand, is going to be about blood pressure. And here's some of the things that we thought would be relevant to cover off. Starting off a little bit about the background of what is blood pressure from a pathophysiologic perspective. What's going on in our bodies to make blood pressure? And why is blood pressure a bad thing, and how does it damage the body? Importantly, we'll talk about how to prevent high blood pressure in the first place, or better manage it if you've got it. And how do you find out if you have high blood pressure? How do you do some good, thoughtful measures, and you can do your own monitoring in this way. If you do have established high blood pressure, as many people do who are participating in the cardiac rehab programs or in the community, what can we do about it from both a non-medication lifestyle perspective, as well as if you need medicines, then how best do we work with those? And interspersed through this, very apropos for this group and this series, are some specific pieces of advice or observations that are relevant for women. Hopefully this will meet the needs of the audience. And as you walk through this, if there are particular questions that you want to enter into the Q&A part of the platform, then we'll certainly address those at the end of this. Okay. So what is blood pressure? So I think we're all aware that we've got this big heart in the middle of our chest that pumps blood around our body through large blood vessels that are called arteries and then arterioles. Our heart squeezes and pushes blood out, and our blood vessels are very elastic, and they stretch and then they contract. And this force inside of the blood vessel from the blood pumping around is what is measured from the blood pressure perspective. Of course, it's important that we drive the blood through the body in order to deliver the nutrients and oxygens to all the places where it needs to be. High blood pressure, or the other term for this is hypertension, and hyper is high and tension is the pressure that's in our body, means that there's too much pressure inside of our blood vessels. And if this goes on for a long period of time, like months and months and years, without mitigation, then this may damage our blood vessels, the big ones and the small ones, and lead to health problems that we'll describe a little bit later. For most people, despite our sensitivities, our intuitiveness around how our bodies are doing, usually you can't feel the change in your blood pressure, even though we think we might know when our pressure is high, that most people actually don't have that sensitivity. Sometimes we can feel when pressure is too low because there's not enough blood going to our heads and we might get a little bit dizzy. But in the range of normal to somewhat high, we may not feel all that different. So bear that in mind. So what do our blood pressure measurements mean? So I think we're all familiar with the notion that we often describe blood pressure as one number over another one number. The upper number is the higher one. The lower number is the lower one. Then the upper one is called the systolic blood pressure. And this is the pressure generated in the blood vessels when the heart actually beats and pushes blood out and blood vessels are stretched to their maximal capacity. That's the upper number. The lower number, called diastolic blood pressure, is what happens when the blood vessels actually relax. But they don't relax completely and collapse down. There is a resting pressure in those blood vessels. So systolic over diastolic, and 120 over 80 is represented as the ideal blood pressures that we might strive for all of us. And elevations in either the systolic blood pressure or diastolic blood pressure, both of them can cause hazard to our bodies over the long term. Blood pressure tends to increase with age because our blood vessels get a little bit narrower or actually get physically stiffer as we get older. And as a result of this, the heart needs to work harder to pump blood through the blood vessels. And since the heart is trying to pump blood tens of thousands of times every day, you can imagine that becomes a stress on the heart. It's also a stress on the blood vessels themselves because they're taking this beating all of the time. What should your blood pressure be? So if you are getting it measured at your healthcare provider's office, or if you're getting it done at the pharmacy or the grocery store, one, just make sure that you're trying to do this under optimal conditions. Make sure you rest and relax before getting those measurements done. Ask whoever the store owner would be, have they had the machine checked out in recent times, just to make sure it's measuring the way things should be measured. These are some general guidelines about like what the healthy blood pressure cutoffs might be before we start to think about something else that we might need to do. And for most people, that we may accept a blood pressure up to 140 systolic over 90 diastolic. I'm just going to put an asterisk there that when we talk about treatment targets, that will recognize that these upper numbers that define high blood pressure may in fact be a little bit too high, but they're reasonable to say that if you're living below that, we may not need to be jumping into medications and things like that, but we will definitely need to pay attention. For people who are age 80 or older, you can see that we may be willing to accept a slightly higher systolic blood pressure because those vessels are a little bit stiffer. They've accumulated some wear and tear over time, and lowering those blood pressures too early may actually cause a bit of challenge for those of us who may be a little bit older. And if we're living with another condition like diabetes, where our blood vessels and other organs like our kidneys may be very susceptible to blood pressure effects, then we might want a slightly lower target before we start thinking about introducing blood pressure medicines. So a normal blood pressure for you really depends on who you are and the company that you keep vis-a-vis what else is going on in your body. High blood pressure, we said that the word for this is called hypertension. So what is hypertension? When our blood pressures are higher than those normal values, when it's above those healthy range. And one thing we'll say about blood pressure, because this is a question that often comes up, is why is my blood pressure changing so much? I had it measured at the physician's office or the nurse's clinic, and then I went home and checked it, and it may vary by 20 or 30 or even more. And that's absolutely true. The constant thing about blood pressure is that it changes constantly depending on what you are doing, what time of day. So when you are moving around and active during the daytime, blood pressure tends to be up. If you happen to be mentally stressed out under, severe social or work conditions, then the blood pressure may be up. But when you're at home relaxing, resting, blood pressure goes down. And when you're actually into a good sleep pattern, then the blood pressure is probably at its lowest time of the 24-hour day. Most people can't tell when their blood pressure is high. We've said that already. So some people have coined high blood pressure as the silent killer. Oh, that's a scary thought. High blood pressure can indeed harm you. So it's important to know your blood pressure measurements. They're your own numbers. You need to know them, and you can actually take steps to actually recognize them and know them and own them. So how does high blood pressure harm the body potentially? Well, because blood flows throughout the body, blood pressure has effects on all of the organ systems. But here's where we might be looking for the effects of blood pressure specifically, that As blood pressure has wear and tear on blood vessels, it may cause stress on the heart. It may cause narrowing of the blood vessels that feed the heart itself, the heart muscle. That may lead to angina, heart pain, or heart attack. Another version of heart problems is that we've already said that if the pressure is high for a long period of time and the poor heart has to keep hammering away and trying to push blood out of itself, then that can cause wear and tear and cause stretch and loss of function of the heart, so-called heart failure. If there is a lot of blood pressure that is flowing through the kidneys and hammering through the circulation there on a constant basis, then this may cause damage to the kidneys over time. And high blood pressure contributes to the development of kidney failure in many people over time. And people who develop kidney problems have more difficulty controlling blood pressure, that it goes up even more. So one can get into a vicious circle there. Blood pressure has important effects on the brain itself as well, because obviously there's a very rich blood supply to the brain. If there's damage to blood vessels, then there's damage to brain tissue, which can lead to memory loss or development of stroke. In fact, high blood pressure is the most important risk factor that there is for stroke in the first development, or the recurrence of stroke in the secondary. So paying attention to blood pressure to protect the brain is critically important. Blood pressure has an important effect on the eyes, and indeed, the eyes can be the clue to how your blood pressure control might be. And hopefully at some point, one of your healthcare practitioners has looked at the back of the eyes, because the characteristics of the blood vessels that may be seen at the back of the eye may tell us about blood pressure control. And in particular, if those blood vessels get narrowed or changed, then that can be a signal that blood pressure may have been high for many months or years. And indeed, that may be a prompt for us to recommend therapy. And then finally, because blood vessels are very important to our nether regions, and you know, for men, blood vessels are obviously important for erectile function, that having high blood pressure over a long period of time can lead to loss of sexual function. And of course, this is very important in the context of overall quality of life. So in many ways, blood pressure can be affected to our health and our quality of life and our longevity. So how can you prevent high blood pressure if it's such a bad thing? For many of us, good news, high blood pressure is actually preventable and manageable. There are many factors that we can control that influence high blood pressure, and this table shows that the things that we eat, in particular salt in our diet and fiber and vegetables, can have effects on our blood pressure. Smoking can have variable effects on blood pressure going up and down, but obviously smoking compounds the bad effects on blood vessels and that high blood pressure will have. So if you put the two together, this is a very bad combination. Excessive alcohol consumption can lead to high blood pressure. And I have seen people in my career where the single intervention that we have agreed to is lowering the amount of alcohol that one drinks, and that can actually bring blood pressure under control. A sedentary life and lack of exercise may lead to high blood pressure. Obesity contributes, stress, poor sleep, and sleep apnea may dramatically increase blood pressure. Diabetes is sometimes may compound the effects of blood pressure. And as we've said, the presence of diabetes will force us to think about a lower blood pressure target in order to help keep our organs healthy. And we've already said as well that kidneys are involved in blood pressure regulation. As kidneys lose some of their function, that blood pressure may sneak up and make it more difficult to control. There are some factors that may be beyond our control, like age and sex and family history. But these issues may make us think more deliberately about issues that we can control and pay even more attention to that. So what about high blood pressure in women, and what are some of the observations that have been coming out in the medical literature? The The website in the bottom that's shown at the bottom of this slide is a nice reference if you'd like to learn a little bit more about women in hypertension, but we've pulled out a few of those themes sprinkled through this presentation. First of all, that we are probably all aware that high blood pressure in women behaves differently across the lifespan. The rate of high blood pressure increases after menopause when estrogen levels fall. Many things happen when estrogen, our internal production of estrogen falls off. Blood pressure is one of those things that seems to be related to estrogen. And this may be because estrogen has a strong effect on our blood vessels and is thought to have a vascular protective effect in premenopausal women. And I'm sure you've heard this, that young women are relatively protected from heart disease in general compared to men because that there is this estrogen on board from inside. And when scientists have looked at the effects of estrogens on blood vessels, in general, blood vessels seem to relax with the presence of estrogen. And some of the scientific terms that have come out, that there is vasodilation, that is blood vessels open up. There are chemicals produced at the blood vessel levels like nitric oxide, which is a chemical that allows blood vessels to relax. There is less activity in the sympathetic system, is like the fright or flight kind of activity in our body that makes heart rates go up and blood vessels squeeze and blood pressure go up, as well as the renin-angiotensin system. This is the hormone system that governs how our body handles salt and water and blood pressure control. And these things tend to relax in the presence of estrogen, and conversely, post-menopause, they get activated upwards and may cause blood pressure to go up. And then finally, estrogen may help us protect us from oxidation or kind of rusting inside of our blood vessels. So estrogen, when it's inside of us, produced inside of us, may do all of these good things. We're all aware of the controversies that have been in the medical literature over the last couple of decades about estrogen. And previously we thought, well, if estrogen does all of these good things in premenopausal women, then surely giving estrogen after the menopause would be good for the body. And that made perfect sense as an idea. But what we have learned from carefully conducted studies is that that doesn't seem to quite pan out, that there is nothing like the body's natural ability to produce estrogen. And if we try to give estrogen by pill or creams or by patches, that it's just not the same. And particularly with respect to the cardiovascular system, and that if you give estrogen after menopause, that it doesn't seem to have improvements in blood pressure. And then conversely, if we give estrogen by pill to younger women, so that we give too much estrogen in a way to premenopausal women, what can be seen for some individuals is that blood pressure can go high. So I've seen some young women who have been on oral contraceptive pills who come in with high blood pressure. And then, our conversation is, we can give you blood pressure treatments, or we might need to rethink the oral contraceptive pill if that's the route that you want to go. And of course, there is also this information that while estrogen might have good effects on blood vessels overall, there has been a failure to show that giving estrogen supplementations postmenopausally has an effect on heart or stroke or other outcomes. So we may be using estrogen for its effects on hot flushes or for vaginal dryness or for other symptoms, but it doesn't seem to have those cardiovascular effects that we might be desiring. And then a thought about how common blood pressure might be in women. As we said, that not only is heart disease younger or less common in younger women compared to men, high blood pressure is also less common in younger women compared to men. But once we hit menopause, we can see things accelerate, and menopause is associated with doubling the risk of developing high blood pressure. And then as we get to persons over the age of 65, large surveys in the United States as one data source indicate that high blood pressure becomes very common and more common in women than men. So that if we look at a group of women over the age of 75, for instance, 80% of women will have high blood pressure. That compares to 73% of men. So common in both populations, but it's almost universal in women over the age of 75 because of the loss of estrogen, because of aging blood vessels, because of stiffening of blood vessels. So it becomes a feature of our lives from a physiologic perspective. So if it is so common, it's going to affect many of us as we get older. Let's get good with things that we can do to change blood pressure. And if you remember that you want to change your blood pressure, think about pressure. And this is an acronym, a kind of a word puzzle that comes from our friends at Hypertension Canada. So pressure, you'll see that that's listed out vertically. The P stands for physical activity, and we'd ask you to get regular physical activity. R, reduce your weight. Although we would like to say you should be healthy at any weight, there is some relationship between carrying around a little bit too much weight, especially centrally, and blood pressure. So sometimes weight reduction may also be associated with blood pressure reduction. E goes with eating a healthy diet. And as we've already said, we'll talk about sodium, but here we can emphasize fresh fruits and vegetables and fiber and fish. Those good things that are part of a good heart healthy program are also healthy for blood pressure. And you may have heard of DASH diets in particular that espouse these principles. If there's one thing you want to do for your blood pressure and you really want to maybe delay or avoid medications, then think about DASH diet as one of your solutions. It may be as powerful as taking a medicine for lowering blood pressure. Stop smoking. That's an important thing for your blood vessel health. Eat less sodium, and we'll talk a little bit more about that. Recognize that the person in charge of blood pressure is you, so you can control your blood pressure. Take your medications. Now that's really stretching for the R, but there you go. Take your medications and avoid excess alcohol. I think we've cheated a little bit on those last three to make the pressure acronym, but it's a nice way of remembering some of these things. And we'll come back to it a little bit later, but let's dive into a few of these things now. So what do we mean by being physically active? It's very consistent with the prescriptions that we advocate for in the cardiac rehab programs or in general kind of society guidelines. Get 30 to 60 minutes of exercise or planned physical activity every day. Make it a combination of aerobic activity and even light resistance training is quite fine if you have high blood pressure. Your rehab specialist will guide you in what the right amount of weight training might be. We would generally avoid heavy weight lifting. That's probably not good for anybody, and especially if you've got high blood pressure. Eating healthy, fresh fruits, vegetables, low-fat dairy, grains, low-fat meat, fish, poultry. You'll see that this is very consistent with the Canada Food Guide, with that DASH diet that we've talked about, with the Mediterranean pattern of eating that we talk about in cardiac rehabilitation. It all comes the same. Stop smoking because that's bad for everything in your body. And if you need help, and you need help on a few occasions, then please do chat about it with your healthcare provider or any of us. We'd love to help you on this journey to being smoke-free. Think about salt and think about where there's a lot of hidden salt. And the majority of salt in our diet actually doesn't come from salt shakers. We often use that as an image, but most of it comes from processed foods and takeout foods. Because not many of us go in restaurants these days, but takeout foods, if they are really, really tasty and make you want to crave them, then just ask yourself the question, is it because they've got a lot of salt in them? Those of you who have been doing a lot of cooking at home through the course of the pandemic, then good on you, because you've probably reduced your salt content dramatically by doing so. And if you want to do a fun thing like a sodium quiz, visit the Hypertension Canada website. That's at hypertension.ca, and you can check out how much sodium might be in your own diet. Stress, and there's some interesting experiments that have been done with like mental stress and the effects on blood pressure. If we force you to do math or Sudoku puzzles under pressure, you will see your blood pressure will rise as you do that. So do these kinds of activities, but be mindful about it. Take the time to breathe, take the time to enjoy nature, take the time to go for a comfortable walk. And these are good ways of you reducing your blood pressure yourself. Medications are important. Take them as directed. We'll talk a little bit more about more medications in a few minutes. And less alcohol. You know, the guidance, this is kind of the healthy drinking guideline, which is a funny name for it. And I think we're familiar with these limits that, you know, men should drink less than 2 drinks a day and women 1 drink a day because we may have less of an ability to process this stuff. Those are kind of controversial statements. And, you know, I think the more updated guidelines about alcohol is that this is a very individual discussion. And for some people, these may be very appropriate. For other people, it may be that we need to avoid alcohol altogether because the risks may outweigh any potential benefits that we get from this. And if we're living with uncontrolled high blood pressure or uncontrolled diabetes for that matter, then, you know, adding alcohol into the diet may not be the friendliest things for us as we're trying to manage the rest of our health aspects. Okay, so lots of things that we can do. The other important thing that we can do is actually measure our blood pressure. It's hard to know how our system is behaving unless we do some measurements. So how do I know if I have blood pressure? Remember that we can't feel it ourselves. And you really actually have to measure it. That's the only way of knowing about high blood pressure. And what's shown in this diagram, I'm sorry, I should have put in a photo of a woman having her blood pressure measured, but the compatriot would be maybe a woman has actually set up this man because he's doing many things right. He is in a chair with back well supported. He seems to be comfortable. There are few distractions around him except for a plant. The blood pressure is on the non-dominant arm. The cuff is at heart level, and he's using one of these automated devices, and hopefully he's been resting there for a few minutes before actually checking his blood pressure. So those have all of the good technique things. We're going to reinforce them in a minute. But now when we've set ourselves up in this way, that's the time to measure blood pressure. If we're doing it under stress conditions, this is not a good way of actually measuring blood pressure and knowing how we are behaving. How often should you measure blood pressure? Well, it depends again on your situation. If you've got underlying known high blood pressure, or if you've got underlying conditions like diabetes or kidney disease, then you should be checking your blood pressure frequently, just to make sure that it's behaving in the right way. On the other hand, if you've been told that your blood pressure is quite normal, then maybe just getting it checked every year or two is quite fine. As blood pressure goes up, then we should measure it more frequently. And if it is actually quite high, higher than a healthy normal, then we should check it frequently. And if you need to check it frequently, then we might think about getting a device into your own home to get this checked out. Because who can check your blood pressure? Well, your doctor or nurse can do this. Your pharmacist might do this, but the central person is probably you who should be doing this. So if you are going to embark on this, I think this is money well spent. These automated devices are about $100. They're widely available in stores and online. You can get them at your favorite kind of big box store as well as in your pharmacies. And get one of these automated devices, and the acronym we use for this is automated office blood pressures, as the preferred measure for even measuring blood pressure in the office as well as at home. The automated office blood pressure measurement more closely approximates what your blood pressure is when you are walking around in your daily life. And the automated office blood pressure more closely aligns to the risk of developing bad things like heart problems, kidney problems, or blood vessel problems. If you are going to buy an automated blood pressure monitor for home, then look for one of these check symbols on it. It's like the seal of good housekeeping. It's the seal that Hypertension Canada, which is a volunteer organization of really smart people who manage blood pressure across the country, composed of professionals and patients. They look at the performance characteristics of blood pressure monitors and deem them that they might be really good to use, or not good to use. So look for this checklist symbol to look for devices that are actually well sanctioned. And then, as we've said, do these good things. And if you want the checklist after this session, you could, of course, watch this again, or you can visit the Hypertension Canada website and you can actually get this checklist with you. Carefully read the instructions, go to the bathroom before measurement. There's nothing like a full bladder that makes blood pressure go up. Sit comfortably, have your feet on the floor, your back supported, your arm at heart level. A bare arm is the preferred method, but if you've got a long sleeve shirt that's hard to roll up, rather than try to squeeze it against your arm, you can have the sleeve just all the way down to your wrist. And then as long as it's a thin layer of material, you can put your cuff directly over it on your upper arm. Put the cuff on and just hang out there for 5 minutes. Think calmly, do some meditation, do some visualization. Take 2 readings. Wait 1 or 2 minutes between the readings. Usually we'll ask you to discard the first one and then just wait 1 minute and do the second one. And that's a more true reflection of what's going on in your body. Write this down. And if you want actually a blood pressure log, then you can get one at the Hypertension Canada website. Record the date and the time with your measurement and keep this in a little logbook. For the people that are really good at computer kind of software, then you might put this onto a spreadsheet, like an Excel spreadsheet, and just plot it out. So these would be very helpful things. When you are checking blood pressure, here's a few don'ts. Don't cross your legs, because that might cause a little of extra back pressure in the blood vessels and may cause the blood pressure to go up. If you're in a rush, like I've got to get to work, I've got to catch the bus, I've got to go pick up the kids, well, then don't check your pressure right at that moment. Wait until you can actually take a bit of time to do it. If you are a smoker, well, don't smoke before measuring, and do get some help with quitting smoking. Don't drink caffeine 30 minutes before measuring. Now, caffeine, if you're used to caffeine, it probably doesn't have a big effect, but if you're drinking coffee or tea or colas very intermittently, then the caffeine might have an effect on the blood pressure. So try to avoid these few things. Put yourself in the best position. Don't eat a big meal and then check your blood pressure. Don't wear tight clothing that may cause blood pressure to go up. Don't be distracted. Don't watch the news about politics while you're doing a measurement, because that makes your blood pressure go up. Don't measure your blood pressure if you're cold, nervous, uncomfortable, or in pain. All of those things can affect blood pressure. So if you've done a good blood pressure measurement, then just reminding us that we want to get a good measurement. And if your levels cross these thresholds, then we should think about getting some more advice. And so for most people at home, you'll see that the upper limit of normal is slightly lower than what we might receive at the clinic with the doctor or the nurse. That at home, our pressure might be a little bit lower. So if consistently we're above 135 systolic and or 85 diastolic, then we should probably be flagging that to our healthcare providers to say, look, my pressure is inching up. Do we need to do anything different? Now for women, what's the specific advice? Well, all of those factors that may influence our blood pressure tend to be more common in women. Diet, physical activity, overweight state, salt intake, all of these things may be more common in women. So we have to pay even more attention to the list of modifiable and non-modifiable cardiovascular risk factors that may influence our blood pressure. Makes us pay more attention. There is more variability in blood pressure measurements when you do them at home or for a 24-hour period of time. especially around the time of menopause. I guess this is akin to the hot flushes that might come on unpredictably. Blood pressures may also take swings. So doing careful measurements over a longer period of time might be advisable before we jump in and say blood pressure is a real important feature of my life. And then finally, postmenopausal women may be more likely to exhibit a, quote, non-dipping pattern of blood pressure. And what we mean by non-dipping is that normally blood pressure goes up and down through the course of the day. But for most people who have normal blood pressures, that blood pressure tends to dip when we go to sleep at nighttime, that it goes down to our lowest levels. In the early phases before blood pressure becomes sustained and high, we may lose this nocturnal or nighttime dipping. And postmenopausal women may be more likely to exhibit this non-dipping. And this may be associated then with the observation that our risk of developing high blood pressure doubles in that postmenopausal period. So, if this descriptor applies to any of you who are currently online with us, then be mindful of that. Be mindful of your own health. If you're around the time of menopause, then just be aware that this is the time when blood pressure might take off to some extent on us, and we might need to seek out other care and therapy. So if I do have high blood pressure, what can I do? So one is that we might need some medications, and we're not going to jump into this willy-nilly, but we will think carefully about what the blood patterns might be. We may look over the course of weeks or months before saying we really need to think about medications. Go back to thinking about the threshold values that we might think about to start medications, and to think about the company that we're in. That is, if we are, quote, high risk, meaning that we've got established heart disease, or we've had a stroke, or we have diabetes or kidney disease, then we might be thinking about medications a little bit earlier than we would if we had none of these cardiovascular risk factors or evidence of established damage in our bodies. So think about the threshold values. I've mentioned that we might think about blood pressure targets as well. And there was this study that was published, oh gosh, it's now 4.5, almost 5 years ago, that was called the SPRINT study, that has led many blood pressure physicians and nurses and healthcare providers to think a little bit differently about blood pressure. And people in the SPRINT study had these characteristics of being at least 50 years old, having a systolic blood pressure, that upper number of 130 to 180, and then having other cardiovascular risk markers, like having established heart disease, or having a stroke or chronic kidney disease, or a higher risk, or being over the age of 75. And if you had any of those characteristics, what was done in this study was that people were, half the group was randomized, about 4,600 people were randomized to receiving standard care of about 2 medications on average, which led people to have a blood pressure 136/76, which by convention in 2015 would have been, this is pretty good. This is pretty good blood pressure levels. But the other 4,600 people were randomized to receiving about 3 medications and a tighter blood pressure target of 121/69. And you can see that there was this separation of blood pressure between the 2 groups over a period of 5 years. So this is okay blood pressure control compared to intensive or really good blood pressure control. And what was observed over those 5-year period of time, this is something called a survival curve of events. And the vertical axis denotes the accumulation of bad things like heart attack and stroke or heart failure or dying from heart disease over a period of 5 years. And this graph here that's shown in the upper right is a blown up version of the separation that says if you're on the standard treatment arm, then about 8% of people developed a heart attack, stroke, or cardiovascular death over this period of time, a follow-up. Instead, if you had tighter blood pressure control, then the risk of bad things happening was lowered by about a quarter, or 25%. So if I told you that you are now at this age point of about 65 years old, and we could look over the next 5 years, do you want okay blood pressure control or really good blood pressure control? Because the risk of developing a bad thing could be lowered by a quarter by having that or opting for that tighter control pathway. So that has led some change in office target goals for that high risk group to go for that like 120 range in the high risk population. So just to think about that. In general, treating high blood pressure is a really good thing. It was shown in that study called SPRINT. It's been shown in dozens and dozens of other treatment high blood pressure treatment studies that say we can lower the risk of developing heart failure. Our heart's actually losing their pumping efficiency, reducing the risk of stroke, reducing the risk of heart attack, reducing the risk of dying. And a modest effect of blood pressure, like lowering pressure by 10/5 millimeters of mercury, can have this effect. And that can be achieved by just one medicine or changing something substantive in our lifestyle. So these are things within our control. And it's the combination. It's not one or the other, and it's not a failure of one or the other, but all of these things go together. So eating the healthy diet, getting active, taking medicines can all have a really positive effect. Specifically for women. So the non-pharmacologic treatments may be particularly important for women. Salt restriction in particular may be have an added benefit in women because women may become, quote, salt sensitive, especially after menopause. And you may experience this in kind of nuisance ways, that if you experience bloating or swelling of your feet and ankles that's come on after the menopause, well, that's an effect of salt and water retention. So that can also translate to blood pressure going up. The good news is that paying attention to salt, particularly after menopause, may reduce those nuisance things. It may also reduce blood pressure. Weight loss after midlife, especially losing weight off the middle parts of our body, may be challenging, but may also be quite beneficial. And DASH diets plus weight loss may have incremental effects on blood pressure lowering. Paying attention to alcohol may be really important, and some women are particularly sensitive to alcohol, so even less than one standard drink per day may do the trick on blood pressure control. And exercise may have a wonderful effect on controlling blood pressure, particularly in our postmenopausal years. On the medication side, in general, here's some motherhood kinds of statements. Medicines only work if you take them, go figure. But, you know, this is an important statement to make because in general, most people who are prescribed medicines for blood pressure stop taking them. That's a sad statistic. And of course, there's no way they're going to work if we stop taking them. If you happen to start a medicine, don't be discouraged if next week the blood pressure is not down, because many medicines take up to 6 weeks to show their full effect. So be patient as a patient. Stopping treatment when blood pressure goes back to normal because you've taken medicine can cause your blood pressure to rise again to dangerous levels. So just because your blood pressure goes down with medicine, that doesn't mean you can stop your medicines. There are a few circumstances where that's true, but in general, we have to work hard. And if it's taken us years to get blood pressure up, then it may take us years to get blood pressure back down again. Drugs that lower blood pressure can also have the added effect of preventing heart attacks and strokes. So your healthcare provider may choose a certain medication that's most appropriate in your circumstance. Most people need 2 or more drugs to control their blood pressure. So it's not a failure of this drug. And resist the temptation to say, this drug doesn't work for me. If you started with a blood pressure 160 or 170 systolic, predict that for you to get down to the desirable levels of 120 or 130, it's going to need 2 or 3 drugs plus substantial lifestyle changes to get us there. That's part of the package, and we should set that expectation from the outset. Reminder that each medicine or lifestyle intervention may lower blood pressure by 10 points. If we have a target of 30 or 40 or 50 points for blood pressure lowering, you know one drug is not going to do the trick. And that's part of the package from the beginning. And indeed, your healthcare provider may prescribe 2 or 3 medicines from the get-go. And that's why they're doing so. Specific advice for women that certain blood pressure medicines may have a particular role. Diuretic therapy or so-called water pills, you may know them with names like hydrochlorothiazide or chlorthalidone or amiloride or spironolactone. So there's many of these medicines that fall in the category of diuretic therapy or water pill therapy. They work primarily by helping the body lose some salt and water and lower blood pressure that way. They may have a softening effect, so to speak, on blood vessels. The other thing that they might do is encourage our bodies to hold on to calcium as part of the exchange that happens within the kidney. And of course, if we can hold on to a little bit of extra calcium, it may have a beneficial effect on osteoporosis if we are prone to that as well. Conversely, if we've had a problem with calcium, like developing kidney stones, then diuretic therapy is the thing that we want to avoid. So it's an individual conversation, but for many of us, diuretics may be a cornerstone therapy as part of the cocktail. Calcium channel blockers, and we may know these as drugs that end in "pene," like amlodipine, nifedipine. These classes of medicines or other ones like diltiazem, they may be used for blood pressure, they may be used for the heart to treat angina or rapid heartbeats. There are some studies that have shown that they may be particularly beneficial for preventing strokes in women in particular. So women may benefit from certain therapies. Women may also have the unique experience of experiencing more side effects. Now, I think all medicines have great benefits. All medicines have some potential side effects. And my rule of thumb is that about 5% of people, women, may experience some kind of side effect with the medicine. So it's important to anticipate, to think, be aware. It's not a failing of the medicine. It's not a failing of something that your healthcare provider has done, but it's something that's along the way. Usually they get better over time, so persist with it, but have the conversation. Don't just cast your medicines aside. I'd ask you to do that. Okay, so long chat today, and knowing about your blood pressure and knowing how you can manage your blood pressure, really important. Remember this pressure acronym and pick just one thing that you might be able to do today if you're living with high blood pressure, just one thing, and see if that can have some positive effect. If you want some more educational resources, again, go to Hypertension Canada, the hypertension.ca website, and you'll get some more great resources from this, including a diagram, an infographic about how to best measure your own blood pressure, or if you want to know which devices have that Hypertension Canada approval, go to that website and have a look around. Or if you want one of these blood pressure logs, then you can get that at the Hypertension Canada website as well. So that brings us to an end of our session, and I'd be very interested in entertaining any questions that you might have. I'm looking at the chat box. I don't see anything in there at this point. We've got a few minutes for questions if you have any. I'm going
Thank
to
you so
pause.
much, Dr. O. That was
Yeah,
wonderful. What a great presentation. So as
great.
Dr. O said, if you do have any questions, please feel free to type them into the Q&A box, typically found at the bottom of your screen. Please feel free to type them in. And while people are doing that, I have a few questions that I will ask.
Okay, thanks, Lisa.
No problem. The first one will be, is there a best time of the day to take your blood pressure? In the morning, in the evening, middle of the day?
And my answer to that is yes, and yes, and yes. That to really get a fulsome profile of our blood pressure, then we may want to be checking at different times of the day on different days. And they may tell us different things. The blood pressure first thing in the morning may reflect how well are our medicines working through the course of the entire day. Typically, most people take their blood pressures medicines at some time in the morning. So measuring blood pressure first thing in the morning reflects, quote, the trough blood pressure effect. Do we still have blood pressure control at the end of the period when our medicines might be active? So that can give us some information. Measuring blood pressure in the middle of the day when we're active may give us a sense of, do we have pretty good control even when we're active? And that gives us a different aspect of, are we taking the right amount of medicines in the morning to control blood pressure in the afternoon? And in the evening when we're kind of rested and chilling out, then that's another check-in to say, do I have good control through the daytime? Or do I need something else at nighttime as another medicine, as an add-on? And some people will take all their medicines up front. Some people may split medicines from morning to evening. So you can see that different time points can give us different insights about blood pressure.
That's great. Thank you. My next question actually deals with wondering about the effects of a history of having children, and if there is any effect on future blood pressure if you have or have not had children in the past, experienced childbirth.
Yeah, so absolutely. It's interesting how our experiences of pregnancy and childbearing actually do have influences on our longer term health down the road. Um, Particularly if we've had the experience of developing high blood pressure during pregnancy, so-called gestational hypertension, or the experience of preeclampsia or eclampsia, those are the events that happen near the end of pregnancies. Those can have kind of an echo effect or ripple effect down the road in terms of kind of raising the risk for downstream problems like developing sustained high blood pressure down the road or developing heart disease down the road.
Great, thank you. There is one question in the Q&A if you wanted to look at that, and then I do have another question.
Great, and I'll read out this question that if blood pressure is controlled by medication, do you still have high blood pressure? And that's such a insightful comment. And so my short answer to this is yes. That if you are taking medications and you need those medications to get your blood pressure into normal range, then I guess the full-on term is that you have treated or managed high blood pressure. The implication is that if you take away those medicines, blood pressure will usually go back up. Now, the asterisk on this, the fine point on this is there are some people, if you've been on medications for a number of years, there may be a reset to the cardiovascular system, and it may actually be possible to reduce some of these medications. So if you've been on 3 drugs for 5 years and your blood pressures are absolutely normal, like 110/70, and especially if you're getting some symptoms like lightheadedness every time you stand up, then you might have that conversation with your doc to say, could we look at these blood pressure drugs? I have, quote, treated high blood pressure. Could we reduce some of these medicines to see if my blood pressure stays in the normal range? So that's the nuance on that very insightful question.
That's great, thank you. So my final question You spoke a few times about alcohol consumption and excessive alcohol consumption. You talked a little bit about the recommendations or guidance of 2 drinks per day for men, 1 for women. I actually just wanted to ask about red wine consumption, and we've heard in the media and whatnot about the benefits of drinking red wine. And I just wondered if there are any blood pressure benefits and if that is an exemption to the rule, or if you still need to watch your intake of red wine as well.
Thank you, Lisa. You know, alcohol is always the interesting question to bring up with the group, and sometimes the unwritten question is my drinking pattern okay? I'm not asking that of you, Lisa, of course, but there's always that bit of the undertone of kind of just confirming that my behavior might be healthy. But so I think you're quite right that, you know, in the literature around populations who consume wine in particular, that there seems to be this lower risk of heart disease, the so-called French paradox or Mediterranean paradox. We know that in Mediterranean patterns of diet, that part of that is the Mediterranean pattern of living and socializing and having you know, an appropriate amount of red wine with your dinner. And in that context of the overall lifestyle, then red wine may play a positive role. Now, it's hard to generalize that, and no one's done a randomized controlled trial of you drink red wine, you don't drink red wine, or another group doesn't drink red wine. Let's see blood pressure or heart risk. No one's done that study. You know, I think from the cardiac perspective, we've kind of had this discussion that having those sorts of safe amounts of blood pressure or safe amounts of alcohol might be okay. But on the other hand, as we've kind of alluded to, that if your blood pressure is difficult to control, then having any alcohol, including red wine, may not be the thing that you want to have as part of the equation, and eliminating it might be the answer or part of the answer to solving whether blood pressure can go back to normal. Okay. And I see finally, Lisa, that there might be one last question on the Q&A to address before we wrap this one up. And the question comes from an anonymous person who asks, is it dangerous if your blood pressure spikes suddenly from a stressful event? And the answer would be maybe. Now, that's a terrible answer. So we've already said that the natural pattern of blood pressure is for it to go up and down through the day, and it may go up and down by 40 or 50 points. And every time somebody exercises, the blood pressure may go up 50 in a steady, slow, gradual way, and that's okay. But I think as you're indicating that there may be stressors that make our blood pressure spike very suddenly, and the sharp up and downs, I think we would all agree, would not be the friendliest things to do. Now, it's unlikely that that single stressor will cause a significant health event for us, but it may be part of our pattern. And if our day has a lot of these sharp spikes in them, then it may beg the question, is there something that we can do to kind of regain control? And you know, if we can control the stressors in our life, because we can't avoid stress altogether, but maybe it's our responses or the way that they're coming in, that might be a healthier way to manage things. And then I'll also say as a parting comment that if we've noted that this is our blood pressure pattern through life, that there are many of these spikes that occur, then that might be a warning system to say, well, maybe there's something going on with our autonomic control in our blood pressure, and that may be a signal that our blood pressure will tend to go up over time, maybe in the next weeks or months or years, and stay high. So spiking may say, I'm destined for high blood pressure going on in the future, and depending on our circumstances, we may actually suggest that you go on to medications earlier on rather than just leaving it so in a way to try to avoid problems down the road. So that's an interesting pattern. You'll learn from it by those frequent blood pressure checks, and I'd encourage you to have that conversation with your healthcare provider about what that pattern looks like. But it does start with you plotting out what your blood pressure does and what circumstances are precipitating that. Terrific, Lisa. We've used up our hour.
Perfect. Well, thank you so much, Dr. O. That was excellent, very thorough, very informative. We very much appreciate you presenting today. As per usual, today's presentation was recorded and it will be posted online. You can find that on our Cardiac College website if you click into the Women with Heart Online portion of that website, and I will get that up either later today or early tomorrow. One last announcement before we close for the day, which is that we will return on September 8th. So that's right after Labor Day. We'll return with a live exercise session. One of our colleagues, Maria Recupero, will join us that day to lead a yoga class. And so everyone's welcome to join in our live exercise classes. So we hope to see you on September 8th for yoga. Enjoy your day, everyone, and thanks again for signing in.